Welcome to The Cut, a series where I'm talking to experts about how small changes can have a big impact on patient outcomes after surgery. Sarah, thank you for joining me today.
Thank you, Kylie. Thank you.
I'm always so excited to hear your stories. They're great stories about patients and outcomes. And what's interesting though is you've had some challenges with trying to not rock the boat too much with traditional practice, but you've been successful in implementing new and novel things in your clinical practice. Tell me the story. Talk about your journey.
Okay, so I'm a surgeon, as you know, and I also work in the wound care team. So I pay attention to whatever it's published in wound care, particularly incision care. So I wanted to start using some advanced dressings and advanced care in my surgical patients in order to get better results and even stop getting a lot of problems that I was having with MARCs. So I thought and discussed with my team how should we do it. And of course, when we went to the administrator, the surgical administrator or hospital, we know that she would ask us, what do you want? It will cost more. So we thought and we prepared something to give to her in order she could authorize the use. So in Portugal, I don't know if you know, but the hospitals, the cancer patients have the right to go back and forth of the hospital in an ambulance, a transport that is paid by the hospital. So that was the argument that I used. I told her, if you let me use these dressings, the dressing can stay in the patient for up to 1 week, 7 to 8 days. So the patients usually come at day 3 or 5 won't have to go to the hospital on that day. So I'll save one ambulance trip if you let me use this. And with this, saying this, and the ambulances cost average like 100 euros for travel. So that was my punchline, and she said yes, and we started using it.
That's a great story. It's obviously, do you think it's cost driven primarily?
Unfortunately, it is a little bit. It should be patient driven, and the improvement for the patients from the patient's perspective should be enough. But as we all know, most of the times it isn't. And people who pay want to always have like some kind of different revenue, or they want to know if you are saving or not spending too much when we change something in your practice.
I'm sure the patients really liked it though. Tell me, what was the feedback?
I got really good reviews of the dressing by the patient. Most of them stating that they were very happy to shower with the dressing, and it was a surprise for them hearing some saying that they could shower using the dressing. And I had another really old patient with a really fragile skin, and I was also surprised that it worked really well and the skin was not damaged. And I had some patients telling me that they just forgot they had dressing, so it was really great reviews.
That's fantastic. It's really good to hear that the patients only had to come in once after their surgery and reduced the amount of times they needed to come back in the ambulance to the hospital for a dressing change. So that's to be able to do that is really quite good. And did you have any barriers trying to get that into place, or it was just kind of a foregone conclusion?
No, I of course I had barriers. First of all, my colleagues, some of them struggled to understand what I was trying to do, and I had to convince a few colleagues that you don't have to keep checking what's happening with the incision. I still have a few colleagues that think that's the way to do it. But fortunately, I could gather like a month of evidence with my patients, and they were convinced that this is possible and feasible and maybe better for the patient.
And so tell me, how did the patients feel about not being able to see their wound? Is that something that they wanted, or did they want to see what was happening with the wound?
My experience tells the opposite. I think most of the patients don't want to see the wounds. The stitches and the staples are frightening for the patients. They don't want to see it. And they prefer to see the wound only when it's almost healed, and preferably without the stitches or the staples. So I think from the patient's perspective, seeing the wound is not important at all, maybe even not a thing that they want to see. So for them, I think it's better also to have this policy of leaving the dressing in.
And so when it comes to the patient, what's the value of developing those therapeutic relationships with them to convince them, don't take the dressing off, leave it in place? Because particularly when you're dealing with the older generation, they weren't raised on moist wound healing. They were raised upon let it dry out in the sunshine. So you deal with the older cohort. How did you go about telling them not to take the dressing off?
I feel whenever you spend a little of your time talking to the patient and explaining, they all get on board in what we are proposing. Patients really like for us to explain what we are doing and why are we doing it. So just spending 2 or 3 minutes talking to the patients, explaining. So in the first patients I did it, I explained why I'm using this, what are we doing differently, explained the showering issue, and all the patients, the more time that I spend explaining and engaging the patient and the family, more I felt the patients had the need to tell me something about the dressing, as if we were sharing the care. So I explained them, I'm trying this, it's really important if it works, and patients wanted to be my colleagues in the study. They wanted to give me feedback. I also had a patient, like a 70-year-old patient, that kept sending me pictures long after the wound was healing, because he felt he was a part of the study, and kept like at 60 days, I was still getting pictures of the wound, because he felt he was a part of.
Yeah.
Look, it looks really good. I'm feeling good. So.
Well, no doubt that's testament to the way that you engaged with that patient, but you built that therapeutic relationship, which means that they're sending you pictures of their wounds, even though they are healed.
They are.
They still want to keep in
healed.
touch with you. Thank you, Sarah. It's just been wonderful to talk to you, and thank you for sharing your story.
Thank you, Sandy. It was a pleasure.